The CDC is warning samples of the bird flu virus it tested recently show signs of mutations that could make it more transmissible to humans. The Centers for Disease Control says it appears the H5N1 virus mutated inside the Louisiana patient who contracted the nation's first severe case of the illness. The agency suspects the patient became ill from exposure to sick and dead birds in a backyard flock. The CDC said the risk to the general public has not changed and remains low.
Next tonight, a potentially troubling new development about the bird flu. The CDC reporting that the virus mutated inside a severely ill patient in the U.S., which could make the disease easier to spread. But no transmissions to other people have been reported, and the CDC says the risk to the general public remains low. Here's ABC's Phil Lipoff.
Tonight, the Centers for Disease Control finding potentially concerning new mutations in the bird flu from a patient recently hospitalized with a serious case of the virus.
The CDC found that this version of the virus had additional mutations that made it attach to upper airway cells more easily, hinting at a better ability to infect people. That being said, this was only found in the individual that was sick, and there's no reason to believe that this version of the virus is spread more broadly.
But the agency making it clear that the risk to the general public has not changed and remains low. The CDC has confirmed at least 65 cases of bird flu in people in the U.S. this year.
They're monitoring more than 10,000 exposures, but they've only tested 530. What does that mean? That means we're not testing enough. And we know from other viruses that a lot of the spread can be asymptomatic.
For now, the greatest risk may be to animals. Earlier this week, the death of a house cat in Oregon prompting a pet food company to voluntarily recall a batch of its raw frozen pet food that tested positive for the virus.
There's no reason to believe that this version of the virus is spread more broadly in the population, and we've yet to see any person-to-person transmission, which is a good sign that we still have this virus under control.
Concerning news from the CDC. The agency says H5N1 bird flu samples collected from a severely ill patient in Louisiana showed signs of mutation, differing from the samples collected from backyard flock believed to have infected the man. Now, despite the mutation, there's no evidence the virus has spread from the patient to others.
Dr. Anne Ramoyne is a professor of epidemiology at the UCLA Fielding School of Public Health, also the director of the UCLA Center for Global and Immigrant Health. Doctor, we appreciate you joining us. Let's start with that mutation. How does that work, and is there cause for concern tonight?
Well, thanks for having me.
Sure.
And what we know from this case in Louisiana is that this patient, when they sequenced the virus, they noted that there were mutations that could potentially make this virus more susceptible to human transmission, so easily transmitted from person to person. Now, that said, there's some really important news here, and that is they sequenced the virus that was found in the backyard flock of birds and the virus from this person, and those birds did not have a mutation that showed any kind of adaptation to humans. So really this happened in that person. And we think that's really important because it means that what's circulating in the birds is actually not something that's transmissible from person to person at this point. So that's really the important piece of news here. Now, that said, there was some data that suggests that this strain is only a few mutations away from becoming transmissible. So good to keep our eye on it.